We have with us today Gail Hunt, President and CEO of the National Alliance for Caregiving. Thank you so much, Gail, for joining us.
Oh, my pleasure.
Let's start by talking about what the National Alliance does.
We're a coalition of about 45 national groups that have come together around the issues of family caregiving. And we're the people that do most of the national research around caregiving and also work with caregiver coalitions. And we've just launched an international organization of carers groups too.
So let's talk about some of that research a little bit. I'm interested in finding out, for caregivers, do you see differences in the issues caregivers face, whether there's ethnic differences, the role of the caregiver, if they're a parent, a spouse, a child? Can we talk a little bit about what some of your research has shown?
Sure. Well, one of the biggest issues is the fact that there are about 23% of the population 18 and older is doing caregiving. So we are talking about a lot of people, almost 68 million people that are doing caregiving. Of those, about 45 are caring for somebody 50 plus. So we're looking at probably a 70-30 split between men and women. And one of the things that's interesting there is that we know that the role of women is they're generally the ones who take on the personal care, activities of daily living, bathing, dressing, feeding, toileting, transferring from bed to wheelchair or whatever. Men, while they may do, some of them do those activities, they tend to be more handling the financial affairs, doing some of the transportation issues. You know, somebody has to go to chemotherapy or something. So we do see some gender differences there. With regard to ethnicity, when we did the National Caregiver Survey, we oversampled for Black, Hispanic and Asian American caregivers, and you really could see the difference in somewhat more Black and Hispanic families, a higher percentage of them caring for someone who has some kind of long-term illness. And also we did a separate study that looked at out-of-pocket costs for caregivers. And it was really amazing that the African American caregivers, the lowest income caregivers, were proportionally paying the most. So some of them were paying out of pocket 10% of their income for a family member.
Interesting. So your organization that works a great deal in coalition with other state and government local coalitions, what do you do together to try and tackle some of these problems that caregivers face?
Well, we are the group that sort of shines the light on many caregiving issues. Caregiving and work, lots of information about caregiving work, lots of studies on caregivers' health and how it's impacted by caregiving. And then segments of care, so like men as caregivers and children as caregivers, and Caregivers of Veterans is a study that we did like a year ago. The interesting thing about that is that the VA picked it up when we were done and has actually incorporated some of our recommendations into some of the programs that they have now.
Could you share with us a few of those recommendations?
We suggested that there should be a peer-to-peer network where you match up experienced caregivers with beginner caregivers. We said there should be one person at the VA Medical Center that they could go to, and they now have a caregiver resource coordinator at every one of the medical centers. Some of these things were underway, but we gave them the fodder to be able to really move forward with that. So there, yeah, they will tell you that too. I mean, the people in the program, they say that that's what they've done.
I think of caregiving as, if there's support, that it's primarily at the state and local government level. But what do you think the federal government role for caregiving should be? Should there be support at the federal level beyond the veterans program?
Right. Well, there is a program, the National Family Caregiver Support Program, that was one of the first things Clinton signed into law when he became president. So it's been around quite a while now, 10, 11 years, something like that. And it's really the only federal program that specifically focuses on support to family caregivers, and it goes through the Aging Network, which can be an issue for somebody, for example, who's caring for a spouse with Parkinson's who's younger than 60. That could be kind of an issue. But in response to the issues of the combination of disability and aging together, the new Administration for Community Living has been creating over the last several years these ADRCs, Aging and Disability Resource Centers, which cut across all ages. So if somebody's that spouse that they're caring for, they can go to the ADRC and find out what are the community resources that are available. And
these ADRCs, they're in communities all across the country?
Not quite yet.
Progress?
They're working on doing that. They're working on doing that. But the National Family Caregiver Support Program has really been the mainstay. They have respite care, they offer counseling, sometimes training, and they have an other services category where they can tailor things to the caregiver's needs. The other small program that's come up in the last couple of years is lifespan respite. And that's been, as I said, a small program. States have to apply. I think there were 12 states that received money the first round, and maybe, I don't know, another 12 states. But the money is not to provide respite. The money is to sort of strengthen the infrastructure that your state has for respite and training.
So if I'm a caregiver and I have previously not sought support at all, where should I start? I don't know if no one has phone books anymore. Do I start on the internet? Do I look at my local government and state government?
State and local governments do get a little bit involved in supporting family caregiving, but they, of course, with the recession, they've really cut back on those programs. I would say the first place I'd go is there's an 800 number for the Elder Care Locator, which is the federally funded program. It's 1-800-677-1116. And they can go to that program, they can call it up and tell the person that they're caring for someone, tell them where the zip code is, and then see if they can't provide them with some kind of services.
That's an excellent resource. You know, Gail, technology, at least from my perspective, is changing everything in all of our lives, in personal lives and business relationships. Is it changing caregiving? Is technology being used to stay in touch more, or even to monitor what's going on at the home? Have you seen technology? Is this a good thing or a bad thing in caregiving?
There are a lot of people that are interested in finding ways to support family caregivers, in part because of the aging in place issue. We want to be able to have our parents or the person that we're helping be able to stay in the home as long as possible. And there's a financial incentive for the government to pay attention to that, of course. But there are lots of people in garages and all, so I'm kind of trying to create programs, as well as big corporations like Intel that are looking specifically at creating things for the family caregiver to help support them. And in-home monitoring, passive monitoring systems, they're called, where there are embedded monitors, very small, that can tell whether a person has fallen. They don't have to have an emergency response device. It can tell whether they got out of bed, did they go into the kitchen, did they, get something out of the refrigerator, so that you know that this person is up and about. And so if you don't see that as the caregiver, I don't mean visibly see it.
Right.
It reports information to you at the internet, via the internet. So you are at work, you can see if your mother got up and is out and about this morning.
Without the negative connotation of the spying like a nanny can, but you can tell that the routine is going forward.
Exactly.
Do a lot of people take advantage of this, or do you see this as the wave of the future?
Oh, it's just getting started.
Yeah, it's exciting.
And the other thing is the handheld devices that can measure vital signs, and you can trigger, you can say this, it'll do a little like hemoglobin A1C if you have diabetes. They also are developing those devices, and they report to the caregiver, but they also report, probably more importantly, to the physician. They are having devices that can measure difference in walking, which would be important in Parkinson's. And they're looking to get devices that can also be monitoring symptoms of dementia, when dementia begins to occur in people, and what's the progression of that. And that's, of course, a big issue, I know, in later stages of Parkinson's, and is a really big issue to family caregivers, the concern about safety and those issues.
Absolutely. Thank you so much, Gail, for joining us today. That was a very interesting conversation with a lot of helpful tips for our advocates. I really appreciate your being here, and I know they'll take action as you've suggested.
Gosh, you're welcome.